My name is Vasiliy. Friends and family call me Vass. I was in Louisiana on a job interview, and during physical I was sent to emergency room. All the door open and at least 5 people with snow white faces storm in and said that they are surprised I'm not dead. I thought I have this condition before. I did not know how to call it and what caused it, but sudden weakness, cold sweats, tunnel vision sometimes appeared.
But it was very odd. In between all of this, he would go on bike rides for 37 miles. So when these things started creeping up and popping up randomly, it was very confusing.
Long-standing persistent atrial fibrillation is a disorder that seems to occur almost naturally as we age. It leads to a lot more visits to the doctor, more medications.
The symptoms from atrial fibrillation, they range in severity, but they can also sort of range in obviousness. Some patients are overtly aware of their heart beating irregularly in their chest. It's sort of a palpitation. It's maybe even more common that patients don't feel the quivering in the chest directly, but they feel indirect symptoms. They feel just tired, they feel short of breath, and they don't know why, because the atrial fibrillation wasn't overtly obvious to them.
When heart not working, lungs does not work properly either. So I cannot even lay down because it filled up with liquid and I am suffocating. I was a semi-vegetable state. I volunteered to do dishes, but even though doing dishes, I need to take a break and head in for the armchair before I collapse somewhere. It was a very miserable existence, and we met these wonderful people who said, we have a remedy for you, we have an answer.
The conversion procedure was new to us when Vass came to see me. I identified him as someone who was supremely affected by atrial fibrillation.
It's a hybrid procedure where both a surgeon and electrophysiologist combine their talents in order to give you your best result for ablating persistent atrial fibrillation. We make a small incision that's about 2, maybe 3 inches long, and then through that goes a camera and then also the ablative device.
After he does that, I come in and do a catheter-based procedure where we go into the heart. I can identify where he's done his work, and then we build on that. We connect his tissue changes to the other areas of the heart where atrial fibrillation comes from, and I can sort of finish the job from the inside.
And things are pretty rapid recovery, and people get back to their normal quality of life rather rapidly.
The first week he was home, there was so much difference in change, just his attitude.
Within 2.5 months, I felt much better. By the time the good weather arrived, they removed all restrictions and from all medications. Julia said, when next time we need to see you? And the doctor kind of looked at us both and said, what for? You're fixed. Move on with your life.
At this point, Vass has been free of atrial fibrillation now since this procedure. So at this point, he is free to fly and there aren't any restrictions on him. He can be as active as he wants to be. Having the hybrid approach in our arsenal, it brings an option for patients that didn't have great options before.
Because he was so discouraged. There were days when he didn't want to really live. It was that bad. And to have that all change, we're free now.
It's really nice to live looking forward to something.
The bicycles have come out of the garage, the kayaks. Our granddaughter came, we went hiking with her.
I just running around like a kid. I did not losing the breath, I am not in pain.
And the coolest part is he does the dishes every day. He does.